You're watching Transforming Transportation 2021, the virtual edition. My name is Femi OK. I am your plenary host. We are about to start plenary session 2, and we start it very stylishly with Mamta Murthi. She is the Vice President for Human Development at the World Bank. Mamta, the virtual floor is yours.
Thank you so much, Femi, and hello to everyone who's attending this session. It's an honor for me to speak today at Transforming Transportation to kick off this session, which is on transport and health. And indeed, transforming transportation is what is needed in a world that is more interconnected and where there are many more touch points between transportation and health, as the COVID-19 pandemic is making clear. In this keynote address, I'm going to talk about 3 things. First of all, the Human Capital Project, vaccines, and the role of transportation. The second thing I'm going to talk about is road safety. And then finally, I'm going to close with a little bit of a plea for making transportation more inclusive. So first, the pandemic. I think it would be an understatement to say that it's taking a very heavy toll on the health and welfare of billions of people in the world. It's devastating economies, and it's making poverty worse. In fact, we estimate that by the end of 2021, up to 150 million more people will be pushed into extreme poverty because of the pandemic. Now, as countries struggle to contain the virus and to save lives and to rebuild their economies, in human development, we focus on what we call human capital, which is the knowledge, the skills, and the health of people that they accumulate over their lives, and which is essential to economic growth and productivity enhancement. Now, we believe that because of the pandemic, there is an ongoing loss of human capital, and this will have crippling long-term consequences. Through lost jobs, through school closures, through missed childhood vaccinations, through regression in health, nutrition, and more. And this is why we, at the World Bank, we have something called the Human Capital Project, and it is now a network of nearly 80 countries. It's a network of governments, of private sector, of NGOs, and the focus of the Human Capital Project is to help countries tackle the worst barriers to human development, using a whole-of-government approach in which infrastructure and transportation are essential integrated elements. Now, what do we think is the impact of the pandemic on human capital? For that, we use something called the Human Capital Index. And what it does is it measures what is the contribution of health and education to the productivity of a child born today, if she has the health and education that prevails in the country that she's born in. And the first thing to note is that despite the progress that has been made, even before the pandemic, a child born in a typical developing country can expect to achieve just 56% of their full potential relative to if they had good education and full health. For low-income countries, this number drops to 37%. So you can see that that things were pretty bad even before the pandemic. And we estimate that the pandemic will actually set countries back by a whole decade when it comes to human capital because of the impact on nutrition, on childhood immunizations, on lost jobs, and on survival. So what can be done? Well, we're very fortunate there's been rapid advances in vaccines, and COVID-19 vaccines, alongside widespread testing and improved treatment, as well as strengthened healthcare systems, will be critical to protecting lives and to helping economies get back on track. And that's why at the World Bank, we're working very hard to make sure that low and middle-income countries are not left behind in accessing these vaccines and treatments. And we approved up to $12 billion to help low-income and middle-income countries purchase and distribute vaccines and strengthen their health systems. And this adds to an emergency response that we mounted early last year, which now is being deployed in over 100 countries and is a part of a $160 billion World Bank Group program to support countries. Now, where does transport come in? Well, logistics and transport will be key to the distribution of vaccines to ensure that they get from airports to cities, from there to hospitals and health stations in both urban and rural areas, and even get to the most remote village so that they can reach people who are in need. In fact, we need vaccines to go to the very last mile. And these will need to be transported by aeroplanes, by trucks, by trains, by cars, by boats, even by motorcycles, as was done, for example, in the Democratic Republic of Congo with the new Ebola vaccine. In fact, some people are even talking about drones to deliver vaccines. All of this is to say that transport is essential to the recovery of the global economy and to the saving of lives. This example that I gave about COVID-19 vaccines is just an example of the role of transportation in connecting people to the services that they need in order to reach their full potential. I can reel off a list of examples. Children can only get an education and improve their future job skills if they can first get to a school. People cannot contribute to the communities that they live and work in if they cannot get to a health facility for healthcare or get to a market to buy or sell goods. Not to forget some of the most excluded members of our society, women and girls are often deprived of opportunities to develop and utilize their human capital without access to safe transport. That being said, the other side of the coin is that inefficient and unsustainable modes of transportation are a leading cause of air pollution and death and pose a major environmental risk to health. To just give you a few facts on this, in 2016, outdoor air pollution, some of which is caused by transport, was estimated to cause 4.2 million premature deaths worldwide, and over 90% of these were in low and middle income countries. And now I want to come to road safety, because adequate transport design and regulation is extremely important for tackling road crashes, which kill an estimated 1.5 million individuals every year, of which 90% are in developing countries. Now, road crashes have a direct effect on human capital. We have data that shows that road crash deaths and injuries disproportionately affect adults during their prime working years when they are working and raising a family. And road crashes rank amongst the leading causes of long-term disability in the world. Road crashes also cause a massive number of injuries. And just to bring it back to the COVID-19 pandemic, we know that in countries such as India, nearly half of hospital beds in surgical wards are occupied by road crash victims. To give another example, in Bangladesh, on any given day, 30% of the country's ICU beds are often occupied by road crash victims. Yet it's these same ICU beds that are required to treat COVID-19 patients. That's why reducing the number of serious road traffic injuries that require medical care would greatly relieve overstretched health systems at this point of time, in addition to being extremely important to protecting and preserving human capital. In a recent report, which we called The High Toll of Traffic Injuries, Unacceptable and Preventable Loss, we note that road safety interventions are among the best buys in economic development, since they yield measurable dividends more rapidly than many other investments in human capital, and they involve relatively modest implementation costs. Effective measures include things like speed limits, especially in urban areas, measures against drinking and driving, increasing the use of seat belts, motorcycle helmets and child restraints, and last but not least, reducing distracted driving, especially from mobile phones. So, as we launch the second decade of action on road safety, there are many lessons that we can draw from. And I'd like to give one specific example, which is dear to my heart, because it comes from Tamil Nadu, a state in South India, and I'm half Tamilian, so this is an example that I really relate to. Until 2014, nearly 15,000 people died every year in Tamil Nadu from road crashes. But this has been reduced by over 25% in a short 5-year period. So, what did Tamil Nadu do right? Well, they did a lot of things, and I just want to list. I just want to list 5 critical things which were introduced by the Road Safety Leadership Group of Tamil Nadu. First of all, there was more policing and consequences for reckless driving through law enforcement. Second of all, there was improved trauma care with emergency care centers on crash prone road stretches and dedicated call lines to allow for a very dynamic position of ambulances. Third, there was data management and improving trauma care through incorporating registries in hospitals for systematic data analysis and first responder response. And incidentally, this was also important for dealing with COVID 19. Fourth, there was an introduction of a digital database and that maps road accidents and identifies the most crash prone spots. And this system was linked to medical facilities. And this is what allowed a post crash response time to come down to 14 minutes, which is on par with the world's best trauma services. And finally, there was a huge investment in road safety programs, and that involved both education but also rectifying more than 200 crash prone spots. So the results of this were really very impressive. And what it shows is that working across sectors, especially transport and health, can have a huge impact on lives and opportunities. Finally, it would be remiss of me not to make a plea for more inclusion in the work that we all do together on transport. And I'd like to make the point that women and girls in particular face huge barriers to both jobs and schooling because of poor access to good transportation and affordable transportation, as well as harassment concerns in public transportation. So, with that, I would like to conclude and just make the point that it's to me, transport and health, both public health and healthcare, need to work together in order to achieve human development outcomes. And this was always important, but it's even more important as we think of a post pandemic recovery and think of building back better. We need to ensure integration across transport and health, both at country level, but also at global level, and work together as an international community with a sense of solidarity to address the joint objectives we have in terms of post pandemic recovery. I sincerely believe that transport is a great enabler and equalizer. And I want to challenge myself and challenge everybody on this call to think of better ways in which transport and health can be better integrated in the work that we do. With that, let me stop and hand it back to you, Femi.
Thank you very much, Mamta. Mamta, are you open for a couple of questions, a couple of thoughts here? Let me start with the hardest one, because you are Vice President for Human Development for the World Bank. All right, so Mauro wants to know if, regarding road crashes, if you added up the figures, the stats, should we consider it to be a global public health epidemic because it kills more people than malaria and TB?
So I would consider it. This is a great question, first of all, and I'm really glad that people look at the statistics and ponder them. Uh, it's hard to use the word epidemic because epidemic is typically used for something that's transmitted from one person to the other. But I would say it's a big global health issue because it kills so many people, and it's something to which we need to devote a lot of attention.
You know, I know that comes from somebody who is totally invested in road safety, and I can see a lot of the questions are very invested in road safety. But for now, Mamta Murthi, thank you so much for kicking this session off. Really appreciate you. I know you'll be watching, even though you may not be in the rest of this session. Vice President for Human Development at the World Bank Group. Thank you. And now,
Thank you so much,
I'm
Femi,
going
and
to.
all the best.
You're so welcome. Let me remind you that our session is about safe and healthy journeys, okay? All journeys, all kind of transport, and the intersection of transport and also health. It's not something that we always connect together unless you work in that field. I'm going to say hello to George, Etienne, and also James. Hello, panel. Really nice to see you. And the panel is going to give themselves the best introduction they've ever had in their entire life because they're doing it themselves. Etienne, introduce yourself to the TTDC21 audience.
Great, thanks. Hi, everybody. Good to see a few of you. I remember not so long ago, a year or so, but it seems a decade ago, we were all in Washington for the meeting last year. And here we are in a very different environment. But I'm very happy to be here. I'm Etienne Krug, and I'm Director for the Department of Social Determinants of Health at the World Health Organization, a department that looks at issues like road safety, as well as issues around equity, urban health, etc. So I'm very happy to be able to be here and discuss across sectors these issues between transport and health.
Etienne, it's so cross sectors. There's so many topics we're going to get into our 1 hour talking to each other. Hello, George. Really nice to see you. George, formally introduce yourself to our international audience, who you are and what do you do? Go ahead.
All right. Good morning, good afternoon, and good evening to all. My name is George Njao. I'm the Director General of the National Transport and Safety Authority based in Nairobi, Kenya. What I do for a living every day when I wake up is tasked with, in the state of Kenya, on the registration and licensing of motor vehicles, as well as training and ensuring that the transport system is safe and reliable as we go across Kenya. Thank you very much.
It's a lot of work you have to do there, George. Thank you for making time for us today. Hello, James. Introduce yourself to our international audience.
Hi, everyone. So I'm James Woodcock. I'm reader in Transport and Health Modelling at the University of Cambridge. And a lot of my focus is on physical activity, the health benefits of physical activity from walking and cycling. And overall, I try and look at how we can maximise the health benefits of moving to a zero carbon transport system, to sustainable transport.
It's really good to have all of you gents. So if you're on the Hop-In platform, that's the fancy one, the one that's a virtual world that you can go to the exhibition centre and you're now on the main stage. If you're on that platform, you will see that there's an area where you can chat. That is where you put your questions and your comments in. I will be calling on your knowledge. You are my co-host now, TTDC21 audience. That's also the hashtag, to bring your thoughts, your questions, maybe your pushback, and maybe your support into this discussion. You're part of the session as well. So use that little chat box to do that. But first of all, James, where should we start? How should we start?
Thanks, Femi. I mean, I think when thinking about transport and health, we need to think about the pathways by which transport systems impact on health outcomes. Now, of course, central as we're hearing about is accessibility, is what one can access. So it's important to remember that there it's the access that's important, not necessarily the transport that's important. But there's also a lot of unintended consequences which have been introduced. Now, of course, there's infectious disease. We're talking about the vaccine. You can also talk about infectious disease spread on the other hand as well. But the transport is the mechanism by which people are able to spread diseases. And of course, we're hearing about the huge burden of traffic injuries and different strategies on increasing road safety. Then air pollution, and that was briefly introduced by Mamta. And I mean, if you look at transportation, then PM 2.5 and ozone emissions from transportation sector is estimated that we're talking about up to about 400,000 deaths per year worldwide in 2015. So substantial harms. There's also noise, though, and that doesn't really get the same attention. And noise pollution, it's not just about sleep disturbance and annoyance. So those things do matter for quality of life, but it also affects stroke, heart disease, and some of the estimates I've seen, they haven't been done kind of globally in the same way, but when a study was done for Houston, Texas, and estimated the burden of noise pollution was similar to that from traffic crashes, about 300 deaths per year. And in Warsaw, Poland, a study put its similar estimates to that of air pollution from traffic-related noise. Then, of course, the thing that I focus most on is physical activity, and walking, cycling, great opportunities for physical activity, and compared to inactive people, you can be talking about 30-40% reductions in the risk of premature mortality, cardiovascular diseases, perhaps slightly smaller reductions in several cancers, also reductions in the risks of dementia, depression, Parkinson, and several other diseases. And in fact, you can get a joint impact on many of these non-communicable diseases through air pollution impacts, noise impacts, physical activity impacts. Then, of course, we think longer term, bigger scale, the impacts on sustainability and so greenhouse gas emissions. And I mean, the kind of work we do, I think would argue that there's a limit to technical solutions. And often these, focus on one or two problems, but can increase it elsewhere. For example, driverless cars, clearly the direction things are going, but maybe they lead to more inactivity because they make driving more convenient. And well, I would argue is how we design our towns and cities affects, how people travel, how far they travel, the kind of opportunities they have. And I would say the key principles are around kind of bigger, longer term issues of the density of cities, diversity, having kind of different, having diverse destinations rather than kind of mono land use, public transport, frequency and accessibility. But then also some of the quicker wins we've seen perhaps with, some of them under the COVID, rapid responses and things in terms of demand management around driving, road user pricing, things like low traffic neighborhoods, space reallocation, parking restrictions, and, creating nicer places to walk and cycle, the design and the desirability of the neighborhoods and the green spaces, and safe, pleasant, direct routes that everyone feels that they can use for people walking and cycling to encourage those modes. And then, as has been said also already with respect to gender, and I think more generally the importance of the equity focus within all of these things as well.
Okay. All right. So, what's really obvious for our discussion today, gents, is that there are lots of different areas that we need to talk about. We've got air quality to talk about. We've got physical activity. Are people using their legs, their arms, their bodies a lot less? There's also road safety, which is such a huge topic right now. And of course, the experience that we've been having right now in a global pandemic is really about safe and healthy journeys. I'm going to leave COVID until last or until later. Let's start with road safety because we have a very engaged road safety audience with us, Etienne. Can I start with a question? And this question comes from Francoise. Greetings from Rwanda. What makes global political leaders give less attention to road safety despite the significant number of road crashes?
It's a great question, and one that I've been struggling with for 2 decades or more. I can try to attempt an answer. That I think there's a series of answers probably. One is just that road crashes happen one by one. If I think all the people in Rwanda who are going to die this year on the road would die at the same time, on the same day, suddenly it would be a wake-up call. But because they happen one by one, I think it draws less attention. They're also often poorer people, which draws less attention. And I think there still is a lot of fatalism. People feel like, okay, if my country is going to develop economically, we will have new roads and we will have more cars on the roads and more drivers. And therefore people have to die and there will be injuries. So I think there is that element as well. And a little bit of, okay, we can't do much about it. So I think all of these things are wrong, of course. We know very well what can be done. And we've seen countries from Australia to Sweden to Canada, a number of countries where, for decades, the number of deaths went up. And for the same number of decades now, the number of deaths has gone down to where it was 100 years ago because very specific measures have been put in place. So I think there are a lot of wrong arguments for justifying inaction.
George, let me bring you in here because you are directly responsible for a lot of what happens in terms of transport in Kenya. And I'm really intrigued by how you see road safety and where it is on your list of priorities.
Yes, road safety is actually at the top of my list of priorities. And just to pick up from where my colleague just talked about, if you recall,
Yeah.
a couple of years back when the influenza bat flu had come out and it reached epic numbers, there was a huge outcry in the world towards how to control influenza and avian flu. It's what we're seeing currently at the moment. But yes, the carnage on the roads across the countries, across the board, are much more significant. And we would like to see a more outcry from the entire world towards it. If you've seen the efforts being done under the UN Decade of Action, is to try and enlighten the regulatory arms through their ministries and heads of state to take the carnage on the roads as part of an epidemic, the same way we have taken. It's more like if you look at the probability and severity and you measure the two, they believe that due to the widespread and probability of getting COVID-19, for example, in this case, the severity had shown a significant immediate fatality rate as compared to where you've got millions and millions of vehicles driving every single day, whereas the severity is 1 in every 10,000 or 5,000. So when they equate the both, it is seen by most that it is best placed to put your eggs in the basket of stopping the probability of the spread of the COVID-19 as compared to this other sector. Thank you.
Mm-hmm. James, this idea about road safety, it existed long before there was a global pandemic, and I'm sure it will still be an issue to tackle. The numbers have been slowly going down globally. But what needs to happen now? If we were looking ahead, looking forward, I'm imagining in the last 6 months, road traffic accidents went down because there were a few people on the roads. But then when cars came back, those accidents went up again. James?
Yeah, I mean, we have seen that. I mean, data is beginning to appear, and of course, it can be very useful to understand. And I mean, there is an argument that in many places people do need to be travelling less. I mean, if you look at, say, differences between the US and Europe in terms of the injury burden. I mean, the US has a very, very high injury burden, certainly for its kind of the level of wealth that it has, and partly that's because people travel so much. Even though you've got relatively low levels of kind of walking, you've just got such large distances that people are driving. That pushes up the injury burden. But I mean, even within that, of course, there's massive policies that we know that there are effective policies. I mean, the evidence is there. I mean, it's in the WHO Decade of Action. But I mean, I think some of the tension now, is I mean, it's how much one is willing to say, and I think we've seen this now within the Decade of Action, within the statements about the need for mode shift, the need to move towards more sustainable forms of transport, and how central is that, and the ideas of road traffic danger reduction. That instead of just kind of cocooning people, protecting them by putting helmets on them or moving kind of pedestrians and cyclists out the way, or you're actually trying to make kind of safe systems, streets that people can kind of walk and cycle safely on, rather than as kind of seeing those vulnerable modes as the kind of the problem. I think that's the kind of the tension that's still there, and there has been a shift on that, but I think there's still, depending on the location, a long way to go.
What does Etienne, the second decade of action regarding road safety, really mean? Does that mean that the first decade was not great?
No, I don't think it means that at all. I think the first decade was great. We did achieve a lot in terms of mobilizing communities. We have a much stronger NGO, civil society community, youth community. We have government awareness. We have learned a lot of lessons, and in some countries, rates of death went down. In Brazil, I think it's 20 or 30%. In the Russian Federation, in the European Union, all of these big countries or groups of countries have seen important reductions in debt over the first decade. So I see that as a success, but it is true that it's far from enough. We saw a good start, and then competing priorities, other things happening, and so we have to do more. So the second decade is a fantastic opportunity, because we have lessons learned. We know what we can build on. We know what works in terms of good laws, good infrastructure, good vehicles, good trauma care. But we also know that just that is not enough. We need a solid leadership at the country, in every country and in every city. We need financing for road safety programs. We need to think about this modal shift that James was talking about, and not put all our efforts on more cars and more car transportation, but rather promote safe walking, cycling, and public transport. And then in the middle of these 2 decades, we have COVID, which has shaken us all up and has shown us, as was said, that we don't need to take every trip we're taking. We can do a lot remotely. We don't have to go every day to the office. So we can build on that, and I hope this second decade will really see the 50% reduction that our ambition is.
Panelists, let me share a comment with you from Claudia, who's in Bogota. There were 2 amazing programs, Al Colegio Ombici and CMPs. Excuse my terrible Portuguese accent. In the first one, kids go to school, biking guided and cared by an adult. The second, kids walk to school by one parent. How can we get more of these programs around the world? So biking and walking, kids on the bike, parents walking. There were actually programs that people are doing that are very enjoyable. George.
Yes.
I offered you a program from Bogota. Give us a program from Kenya.
All right. Actually, one of the things that the 2 gentlemen, my co-hosts, have spoken about a few minutes ago, during the COVID-19 pandemic, we saw more people walking. We saw more people riding their bikes, more delivery of food taking place. However, the infrastructure that comes along with it was not adequate enough. So we noticed a spike as well in the cases in regards to fatalities on pylon passengers, and also fatalities of hit and runs towards pedestrian passengers, because the non-motorized transport system had not been fully put in place. So what we have done is, like in this example of Kenya, we've been working with the national and county government to be able to try and build that infrastructure. As rightfully pointed out by our colleague in Bogota, yes, it is true that even back in the day, for example, I used to take public transport to go to school back in the days. I used to walk to school, I used to ride a bike, but in this day and age, due to other factors, ranging from insecurity, from emissions, for non-motorized transport networks, it has become slightly difficult. Also, in addition to that, our programming in terms of as parents, it is difficult to get that time in the morning to be able to walk your child to school, okay? Because we got so restricted to working 8 to 5. What COVID has now taught us is that you can have more flexible hours. You can be able to take your child to school, pick up your child from school, because now more parents are working from home, okay? So what we're trying to do as well in the same space is working with various entities across the board. For example, we've gotten certain support to create youth education programs to help bring back, because there's one thing about walking, but it's learning how to walk along the roadside. Okay, one of the examples that I was given, and I'm sure you can ask around the board, how many children know how to cross a road? It's a very simple question. In most countries, it's look left, look right, look left again. Some have zebra crossings, some don't have markings, some don't have lights. And that's what the second decade of action is bringing on board. It's bringing back the basic fundamentals and principles of road usage, not only for the motorized, but all other non-motorized road users across the board.
Can I disagree in there?
Yeah.
Okay. Yeah. So I mean, I just think I always worry when I hear education, in particular education of vulnerable, education of children in terms of road safety. I'd say what you want is a system in which you don't need to do that. If you need to do that, that's the wrong way around. And children are children. Of course, they'll make mistakes. What you need is a safe system that reduces the danger that children face. If you have systems in which children have, very limited pavement, sidewalk access, and then have, multiple lanes to cross, I mean, this is a problematic system. What you need to be doing is providing, low traffic neighbourhoods around where children act, safe routes to school. I mean, if the emphasis is on the children's behaviour, well, then, every parent that can afford to will, of course, put their kid in the car and do so, and it's the parents who can't who will be left there. And it becomes about how do we protect them and cocoon them. What we want is an environment that kind of puts the children and kind of, older people, the people who are maybe kind of more vulnerable in an environment, a system that feels safe for them when they're able to kind of walk, to walk or to cycle to destinations. It should be tackling the source of the danger, not the victim's behaviour.
George.
Yes, I like that. I like the rebuttal. I was waiting for that one. Let's speak for the case in my environment where I currently am operating in. We have to look at it two ways. You have certain areas of where there was dilapidated infrastructure that does not allow us to be able to provide the safe space. So as we are doing that portion of working with both the county and national governments to be able to provide that infrastructure to allow that, we also have to do concurrently the same process of bringing in the information, education, and communication to all users, not just the children. Okay, that's just one example, but also us as well as the operators around the area. So they're all working in a parallel model, where as we build infrastructure, which was not there in place over the years, we're also doing both at the same time.
We are talking about the intersection of transport and health. In this particular section, we were talking about road safety. I'm going to wrap up this little section. It's a big section, but I'm going to make it a smaller section so we can move on and talk about air pollution and other issues regarding health and transport. But I'm going to wrap up, as we've been talking about youngsters and safety on the roads, with Nixon's story. And Nixon is in Tanzania. Have a look.
Makini barabarani.
Kwa jina naitwa Nixon Kiswaga na umri wa miaka 13, niko darasa la 7. Nasoma shule ya msingi Wenda ambayo iko kilomita 2 kutoka nyumbani. Ili niweze kufika shuleni lazima nivuke barabara kubwa inaenda Mbeya. Haya maisha yangu ya kila siku kwa miaka 7 sasa.
Kwa kweli siku hiyo nilikuwepo niko shambani. Nilivorudi ile narudi tu nikakuta mwanangu wamebeba kwenye baskeli wanapeleka hospitalini. Na hapo nikamwangalia kweli mwanangu akawa ameumia. Nikasema aliyemgonga ni nani? Kwa kweli hakuja yule kijana. Ikabidi mwanangu Nixon alazwe. Nikaanza kuuguza. Kwa kweli wakati namuuguza Nixon, kwa kweli sikufanya kazi ya aina yoyote. Maana ilitakiwa nibakie nyumbani nimlee mtoto. Kwa kweli nilihangaika huo mwaka huo, nilihangaika vibaya mno, hata chakula chenyewe nikabidi niwe nanunua tu wakati nilikuwa sinunua. Maana sikuwa naenda shambani na sikuwa nafanya kazi yoyote, hata kiuchumi ilinirudisha nyuma vibaya.
Kabla nilivyokuwa sijapata ajali nilikuwa nashika namba 1 namba 3. Nilivopata ajali nikawa nashika namba 9 na namba 10 kwa sababu nilikaa nyumbani muda mrefu nikiuguza kidonda. Pamoja na matatizo haya bado sijakata tamaa. Bado naendelea kujisomea kwa bidii.
Bringing you a real life example there of the connection between health and safe journeys. We are going to move on and talk about air pollution. James, what was the situation before 2020 regarding air pollution and travel? How did it impact travel from your studies?
Well, obviously, transport's a major source of air pollution. I mean, the relative contribution of transport to air pollution, varies a lot. If you're talking about somewhere like London, then transport's probably the major source of air pollution. If you're talking about a much more highly polluted city like Delhi, then the transport will be producing more air pollution, but you'll also have many other sources of air pollution that are contributing as well. So you're talking about different solutions in different places. As I said earlier, I think the estimates are around up to about 400,000 deaths per year just from transport-related air pollution. In addition to the many other sources of air pollution, the biggest burden is estimated from PM 2.5. That's from fine particles, and I'd say let's also just make sure that we don't forget noise too. I think that's really an under considered health impact. So I just hope we get a chance to get back to that. I think one of the problems with air pollution is to remember, particularly with electric vehicles, that we're not just talking about tailpipe emissions, which electric vehicles don't have, though it depends on the source of the energy where that comes from, whether there's emissions at source, but you've also got emissions from brake and tyre wear as well, and for fine part and resuspension of road dust depending on the setting and so on. So and these can be important. In some places these are actually more than the tailpipe emissions now in terms of particulate matter.
Etienne, from the WHO, I'm sure you must have seen, like I did, those pictures in March of last year and April of last year, famous cities like Delhi and Los Angeles, when everybody was on lockdown and the air was blue and clear and animals were coming back into play. Is that something that is a situation that we can build on post-COVID, or was that just a weird blip and that it's not possible to have that kind of air quality so that we can all be healthy around the world?
Of course it is possible. But before I answer that, I just wanted to come back to that video we just saw, because I thought it was so great. Sure. It showed so clearly that it's young people who are affected, that it is the poor people who are most affected. You could see that road from above at the end going through that village. Clearly, this was a dirt road that had just been tarmac not so long ago, without a sidewalk, without a possibility for kids to walk safely. I thought it was so clear, showing also the mother who has to take off work because her kid has been injured, throwing the family into poverty. So I thought in a few minutes they showed very clearly what this is all about. But answering your question, of course. I mean, it has shown that it is possible to have clean air if we work about transport. Of course, we're not going to be able to implement a solution where nobody travels by car anymore from one day to another, like we have seen during lockdowns. But it shows that if we reduce the amount of travel, if we plan our cities better so that schools and workplaces and shops are closer to the homes and people can do these things by walking and cycling or public transport much more, if we make our public transport safer and more accessible financially and cleaner and more attractive, all of these things will help. And if we become much less car dependent than we are, and that when we are car dependent, we're dependent on cleaner cars, we can get there. We can do this. It's just a question of putting our priorities in the right place.
Etienne, I feel like you're the cheerleader on the panel. Yes, we can do this. And then George actually has to try and implement it. George.
Good luck, George.
Yes, thank you so much. Let me speak about Nairobi, Kenya. During the lockdown, what happened is we got two types of lockdown. The initial lockdown was restriction of movement within specific areas, and the three were what were considered as the high transmission areas, which were the major cities. So Nairobi, Mombasa, and parts of the North Rift were shut down. And what you realize that there was a significant change in the air quality. And for those of you who have actually Googled, I must also say that this year around, in the wildebeest migration that occurred in the last migration, which was around November, was one of the most spectacular migrations. The reason being is that the grass had grown in the Masai Mara, the rivers were flowing, they were raging, all the animals were out. So like nature resets itself. Like what they say in Lion King, the circle of life actually brought back itself in totality. Okay, but when it comes back to us, as part of the areas in regards to lockdown, one of the areas that we had to do was develop protocols of during the mobility of people, like for example, in the public service vehicles. What we realized by the reduction of the number of people to 60%, other ailments like common colds went down, other communicable diseases also went down. So there's a very close relationship with regards to health. But yes, in Nairobi and Kenya at large, the weather pattern changed, it became greener, the whole cycle reset itself. So we have also seen in the last couple of months entry of electrical vehicles into the country under the test program. We have seen the electrical motorbikes being assembled now at the moment. So there is a direct push towards moving towards green energy across the board.
So, George, I'm glad you said that about electrifying vehicles, etc. Because I'm going to connect the dots, because we were talking about climate change being an imminent crisis, and most people who are invested in the climate crisis would say it is a crisis right now, and the future for sustainable transport. And you are bringing us right up to date with what you are doing right now. How do you make that link at this point between climate action and then what you do in your transport policy in Kenya?
Okay, one of the card is that the Kenya Bureau of Statistics, who are the ones who do the policies in regards to protection of vehicles. We've been working closely together with them, because currently at the moment, the age limit of importation of vehicles is 8 years old. Okay, and now you know that has got a direct correlation to pollution. But we have seen now more towards, especially the new entries, which are the PSV equipment in the taxi segment, are now moved towards electrical or dynamo powered engines, which is especially like the Uber, the Taxify, the Bolt. They're now moving towards that direction. And now there are other policies within the national government under the Ministry of Treasure, under the GCF fund, that is empowering and providing that. Now, one of the challenges that is there is that the cost of electricity in Kenya is also quite high as compared to the cost of fossil fuel. So there's that balance that needs to be done in regards to now providing the infrastructure, charging points. So it's still under the trial process. And we've seen countries, for example, like in Japan, has really been spearheading under Toyota Kenya to try and bring it on board. So we are there to support the policies that come across, and we are more agile in moving towards a new environment.
James, you're looking thoughtful. What do you want to ask George?
I'm just sorry, just trying to gather my thoughts a minute and come back on what was happening.
The reason why I'm asking you this, James, is because George was giving us a politician's answer, right? He's giving us a political finessed, nice answer. And James, you've been studying this for a long time, so you cut to the chase.
I mean,
go ahead.
Of course, we need to move to electric vehicles to low emission vehicles. I mean that that is it's a no-brainer. I mean, of course, there's costs. The more it's done, of course, we get efficiencies and so on. I mean, improving the speed with which we do that is absolutely essential. Of course, we need clean energy production, and the more, of course, electric vehicles there are, the more demand there is. The more pressure we're putting on energy production. So the more risk that you're still getting energy production from dirty fuels as well, and that's one of the harms. As I say, even electric vehicles themselves don't necessarily eliminate all air pollution. You're talking about brake, tyre wear, suspension. So there are still air pollution issues, even if the fuel is clean. I mean, that's why I'd stress as well always that we think about demand reduction. Obviously this is different in different places where people are driving very, very different amounts in, Kenya or in the US. Clearly, you're talking about very, very, very different things, but still talking, about different trying to avoid, the worst cases that we've seen in terms of kind of sprawled cities, in terms of the large amounts of driving that then entails, and in terms of the mode shift and the physical activity benefits. I mean, thinking back to the question earlier on about the schemes in Colombia. I mean, what we've seen, the studies in the UK, the research studies. I mean, there's several studies that show that providing high quality infrastructure for active travel can lead to about 45 minutes per person. I mean, the increases in levels of physical activity per week, and that's really substantial. That makes a big difference to someone's health. And as the evidence is developing more, new things being looked at. I mean, some of the studies coming out now on the lower traffic neighbourhoods where both they put in infrastructure to make walking and cycling better, but they also restrict the permeability for cars, stop letting cars drive through areas. I mean, these can make a really big difference. Maybe even up to 2 hours. They're seeing in some cases increases in levels of physical activity per week. And I mean, of course, resources. Just come back to George's point earlier. Are an issue, but many of these schemes are low cost. And I mean, they were put up temporarily in response to COVID and things like that. I mean, you're talking about putting filters in, which can just be some barriers and some cones or whatever that then allow non-motorized transport through, but that don't allow through journeys for cars. I mean, then providing decent quality services, of course, is a more expensive thing. But in terms of your network permeability, there's a lot of low-cost things that can be done, or space reallocation, quite quickly. I mean, you need some enforcement, of course, as well. But things can be done.
Can I come in on this?
Yeah, please go ahead. I'm reminding you guest speakers that we are talking about safe and healthy journeys, just so we stay on topic. Go ahead, Etienne. Go ahead.
Yeah, and I will stay on topic because that's exactly the topic. I mean, we cannot be waiting for electric cars. People have to, or for self-driving cars. It's important. We want electric cars, yes, but that's not the solution to healthy transport. We've had 50 million people die since the invention of the car on the world's roads. If we're going to wait for the whole fleet of vehicles to be replaced by electric and then gradually self-driving cars, we're going to wait for another few decades and we'll have another 30, 40, 15 million people dead by then. What we need is healthy, active, clean transport. And that means walking, cycling, public transport. It means, as James is saying, redesigning cities so that the trips are shorter, and can be done through physical activity, a more pleasant way, which is also better for our mental health. So waiting to replace a car-based system by another car-based system is not the solution for healthy transportation. That's, I guess, my main message today.
Oh, Etienne, Justin Hyatt. Hi, Justin is on the platform today. He says, Etienne is right. We need to concentrate on modal shift. That is shifting away from private motorized vehicles to walking, cycling, and public transport. Let's also dramatically downsize the automobile culture as well. You're getting a round of applause there from our virtual audience, Etienne. George, again, you've got to implement this. Is this realistic in your context? This is the wonderful challenge and the beauty and diversity of our TT audience, because we're in all different parts of the world, and maybe one size doesn't fit all. But if you're a firm believer there should be no cars, I think you think no cars anywhere. George, go ahead.
Yes, let me clarify that slightly a little bit. In the case, like for example, in Kenya, we are moving towards the Nairobi Metropolitan Transport Authority is moving towards the establishment of the commuter rail system as well as the BRT. That is going in concurrence. So what they're doing is creating more walkways and pathways within the city limits, removing more of the congestion within the city to the outskirts of the city and providing more BRT lanes across the country, and especially starting off in Nairobi. They have introduced 5 lines of commuter rail, moving also as well to monorails down to taking people towards the outer scattings of the city, and also providing better connectivity. So it is not only the electric vehicles, there's also the significant shift towards the BRT and the mass rapid transport and other commuter rail system as well.
All right, so George, when I can fly again without having to go into quarantine, what safe and healthy journey would you take me to in Nairobi? And it has to end somewhere where we can get those fantastic donuts, right? So I'm going on a journey in Nairobi. What journey would you say? Femi, 10 years ago, this would have been a terrible journey, but I'm taking you on this journey now because it's safe and healthy. Where would you take me? Take us all, because we're all virtual. We can all do this.
All right. So let's take, back in the day, let's take a journey. You've landed from the airport. You've landed an hour ago. And we're taking you across into the city center. So previously, before, there was one road that was dual carriage, and there was no other mode of transport other than vehicular transport. So singular vehicular transport. Now, at the moment currently that is in place, they have created a commuter rail system that allows you to disembark, take a bus for only 5 minutes or so, and enter the train and go straight into the CBD. So that is the fastest way currently at the moment. But there's also a new way currently undergoing. Yeah. There's also now the expressway. The expressway will be cutting on the upper deck across into the city. So that allows us to have a faster connectivity. In addition to that, we have the bypass system that has been done. And that will be able to bring you to the city. So it is evolving in the last couple of years, and we do hope to connect much faster.
All right. I love that virtual journey. I'll be able to do it in real life sometime soon. James, go ahead. Sorry about that. Go ahead.
Sorry, I was just asking what the expressway is. Is that a train or a car system?
What's the expressway? The commuter train is what goes through from the airport across.
And then just to echo a lot of comments that are coming from all over the world, is it affordable? Because it feels like there's one level of transport that's sustainable for certain groups who've got resources, and other people, like Etienne mentioned, are walking on the side of the road without a pathway. What do we have, George? Is it affordable? Are you there yet?
We're not yet there. It's a mix and match because the infrastructure is currently under development. So it's still a mix and match. So over the years, it will become affordable, but it's still, because currently at the moment, the train, for example, will cost you 300 or so shillings. But then the matatu will cost you 100 shillings. So it's a mix and match at the moment as we speak. And there's also the boda, which is motorcycle.
Yeah, of course. Yeah. All right, so let's tackle COVID head on, because we've been tiptoeing around the edge of it. Etienne, for your organization, what impact has COVID had on your organization, in the way that you operate, in the way that people get around? What would be the safe and healthy journeys take on the WHO?
Of course, it's a huge impact because our organization is in the center of the storm in terms of the response in many different ways, from the data to the access to vaccines to all of it. But and that also, of course, also our ways of working have dramatically changed. Where only 10% of us go to the office still every day. 90% are working from home. We can't travel anymore to the countries that we support. Everything is remote. So it's a huge impact for us as well as for many people around the world. I would say probably everybody. But it has done a lot of good things. It has shown how important public health is to the world. It has shown the role of WHO. It has shown we can work in many different ways. And it has obliged us to think also very much across sectors. This is not only about infectious disease control and medicines and treatments and vaccines. It's also about how we work, how we travel, the topic of today, and how we go around education. All of these things are now on the table and being retold.
Yeah, it's dragging us out of our silos. And you're a great example of that, Etienne, because your speciality is not necessarily safe and healthy journeys, but you are able to cross into different areas so easily. James, COVID-19, when I say that to you about you, your work, your organization, what impact has it had?
Perhaps just jump back. Can I just jump back on the affordability issue? Just half a minute. I mean, of course, affordability, varies, massively between sectors, countries, and settings. But I think we need to remember that small-scale interventions, interventions in terms of improving localities, in terms of greening them, in terms of improving, the local walking and cycling environment, are potentially relatively low cost. And there can also be, I think, the thing with international funders as well, and with national organisations, with a tendency to focus on big schemes. I mean, I think we see that everywhere, and big schemes, of course, are important. Sometimes absolutely essential, but the cost of the things that actually can make a real difference to many people's lives, and then doing these in multiple, that can be quite different. But it doesn't garner the same attention. But I do think it's really important for us to focus our gaze there about the sum of little things that really can make a difference to, maybe not all of the central business districts, but people
exactly.
There.
But wasn't that a beautiful example of the parent walking their kids to school and the kids are cycling? I mean, that was a little thing, but amazing. It's like, oh, that's doable. James, you evaded the question.
Sorry. I mean, on COVID-19. I mean, of course, the UK has been very hard hit by COVID. I mean, there's been a real lack of strategy, constant firefighting, rather than aiming for zero COVID. Now, very reliant on the vaccine. Many countries, of course, have seen big reductions in physical activity. I mean, we looked a bit at some of the US data where you saw big declines in walking, particularly utilitarian walking. There's some increases in recreational walking, and what we saw there was, particularly hard hit were low income groups, low education groups, and those that were previously reliant on public transportation, which was, of course, big declines in public transportation. So, you're seeing big, impact there on something that, of course, is very important in itself, actually probably affects your risk of a serious outcome if you do, if you were exposed, if you did develop COVID as well. I mean, I think we've also, because people are doing more stuff around, where they are, where they live, then, I mean, I think arguments about public rights to space, have come up so much. Public rights to green space. I mean, who has a garden? Those kinds of inequalities. Who has private green space? Who has space in their house, perhaps to, if you're lucky enough to exercise? Well, are you in overcrowded accommodation? And then, what's been done in the area around you to make space, accessible? So I think the kind of, the debate about the commons, about where. And with the streets, when we saw them perhaps emptying of traffic, but we saw speeding increasing, and some people zooming along at kind of very high speeds. I mean, again, and in some places we saw some space reallocation. I mean, there again, you see the debates about whose space they are, and I think that's really important, across settings. And it's just maybe people also just value things a bit differently. It's a chance to reflect. People think particularly about their health. They think about things perhaps in a slightly different time scale, different framing from how they were doing before. And I think thinking about high quality access, local environments, access to green space, pleasant environments in which to be, and even mundane tasks which become a different thing if just getting the coffee is your limit of your daily activities. That's what you're allowed to do, or just the trip to the shops. I mean, it takes a different meaning, and I think maybe hopefully some of the arguments people have been making about building, transforming the local environments in ways that people can be active, can socialize at the moment, distantly socialize, become more prescient to people.
Yeah. George, I know that digitization is something that you're very passionate about, so I'm going to throw this question to you. This is from Hatem. Hi, Hatem. The role of digital connectivity. Video conferencing is the new transport mode for work commuting and the e-commerce for shopping trips. How do you see digitization, George?
Okay, thank you very much. Let's first take it one step back, then so I can bring it home. If you look at the process of a regulatory framework, because that's my bread and butter as a regulator, you have to go all the
Sure.
way starting from the legislative to the regulatory to the registration and actually the licensing. So very simple things that we used to take for granted was the issuance of a driving license, where you have to come and get physical biometrics, take the picture. So you have to start doing during the COVID-19 pandemic was to start having a very risk-based approach on how to continue restricting your services rather than suspending your services and making sure that you still meet the regulatory requirements by law, including what we call inspection and things of that nature. So currently, at the moment, we are going through a massive digitization process because what it has forced us to do is think out of the box on how to continue providing each and every one of these services while still maintaining the standard to avoid being a super spreader. Can you imagine in the case of a motor vehicle inspection center where you're inspecting 100 or 50 to 100 vehicles with two or three inspectors? So it has to see how best can you be able to do it. So we have introduced new methodologies, introducing automation of the process, issues like now, for example, like today, being able to reach out to the rest of the world to see what they're doing, how they're doing it, and try and bring it back home in the digitalization process. Also, other areas that we've been really spearheading is the issue of driver training. We take it for granted that you do realize that when you're examining the student, you're literally next to the other party. So you have to now start bringing in how best can you be able to do it. So we're now looking at the automation process in regards to doing some of the theoretical trainings and in future the practical trainings without interference and getting the two of them on board. So we're going through a whole digital migration that has been fast tracked by COVID-19 to ensure that we still maintain the requirements by law while maintaining the standards provided by World Health Organization.
All right, speakers, you've done a great job so far. I'm going to ask you to do a speed round, which means I will give you a question and you will respond quickly because we've got so much interest in this conversation. Etienne, this is for you from Jonathan. Cyclists are 50% more likely to be killed on the road than drivers. How can we better protect cyclists?
As a cyclist, this question is, of course, very close to my heart because cycling is healthy for protection of non-communicable diseases, because it is good for mental health, because it is good for the environment. We have to do more to protect our cyclists. So we need bicycle lanes. We need so infrastructure that allows cycling to be separate from car travel. But also we need serious enforcement and legislation on drink driving, on speeding, and on a number of behaviors that put cyclists at risk. And of course, we need also cyclists to behave. It's not only the cars, but when you drive a bicycle, you also have to be, of course, aware of the other road users. You have to be visible. So there is a little bit also of responsibility on the cyclists themselves.
A speedy response to Isabella, George. Is it possible that after this pandemic, road safety problems are left in the background? Would that be true of Kenya?
No. The reason behind this is that the policies are, and not being a political answer, but we are spearheading and we're working together across the board, not just for the perspectives of the COVID-19 pandemic, but we do have a natural pandemic in the case of the number of fatalities that are occurring. So it is one of the forefront. So for example, in the case of Kenya, we have mainstream road safety across the board in all government ministries and agencies. So we have now made it as a performance contract annually. So it has now become entrenched into the government system and will be able to be measured on a day-to-day basis going forward for the next couple of years. So we will not be left behind.
One very quick follow-up question. A lot of our audience who are watching from the African continent saying digitization is just not a reality for us right now. how would you respond? Because of connectivity, because of regular power, all of those things. Very quick response. It's not possible.
One quick response, watch this space. Come and see us in 1 year.
I know about Kenya Tech, so Kenya is flexing right now. Okay, I hear you. I see you, Kenya.
World Bank has been really supportive to us, and we have done a couple of projects that have been ongoing, and we just signed on to the Horn of North Africa project that is supporting us in the whole digitalization process. So it is watch this space. It will be a reality.
Yeah, and then you can be the model and show the rest of the continent and also the developing world how you do it when you feel you don't have the connectivity. Watch Kenya. All right. Oh, a little bit of a humble brag there. Very fast response. This is from Jonas for you, James. Change of mindset is still a critical area for dialogue as car owners are quite influential politically. That's why we still see a lot of investment in elevated multi-lane highways in Africa, which does not solve the problem in the long run. Also, it's not safe for cycle paths or pedestrian walkways if they even exist. Car is king, James. How do you solve that?
Well, I mean, I'm not a psychologist. I mean, I think you've got to create new and different aspirations. I mean, I think we have seen a change in aspirations, certainly in many high-income countries over the last kind of 20 or 30 years compared to, when I was growing up, the first thing people wanted to do was get their driving license. That was seen as absolutely essential. Yeah. That was the step. I think that's changed. To certainly to an extent now, people are very much now. They're much more obsessed with their phones, with the social media, with other tech than they are with, and that's how then they would communicate, rather than thinking the stepping stone at 17 as it was in the UK to becoming a driver. And of course we need to see. Role models. We need to see people who've got the choice doing it. But I mean, I think psychology is affected by the environment that you see. I mean, if you see an environment which provides good quality infrastructure, pleasant environment, then I think that for walking, for cycling, then that supports those behaviours. If you see an environment in which you see the prioritisation or the huge highways, then that sends out a very different symbol. I mean, also in terms of kind of road safety, if we say, well, cyclists have to be kind of very, very brightly lit, always, helmets, maybe extra kind of padding and things like that. If that's very much the focus, I mean, that sends out a kind of message. So, I mean, I think what we can do are, is send out, maybe kind of, internationally send out messages in terms of being, normal, healthy and safe behaviours, and pictures of the kind of desirability. Make it aspirational around those kinds of environments that many people want to live in anyway.
Can I just come in on this issue very quickly? I know you want to go fast, but very quickly. I think also it's about, it's true that the car lobby and the driver community are very powerful, but there are other powerful communities out there, the environment community, the NCD community, who need to start realizing that if you want to achieve a healthy environment, you need to get into the road safety business. If you want to tackle non-communicable disease, you have to get into the road safety business. And I think the cyclists community, the pedestrian community have to also organize themselves to become just as vocal as the car community.
Safe and healthy
giving a
journeys.
voice. Pedestrians getting a voice is so important. I mean, they can, it can be people don't even see themselves as a pedestrian. Yeah, even many car drivers, they are pedestrian a lot of the time. Trying to, I think, give people an identity that they see themselves as a pedestrian in a positive way, I think is really important.
This session just doesn't want to stop because it's so amazing. Thank you, guests. George and James and Etienne. Safe and healthy journeys, the intersection of health and transport